Okay, so let's dive into a really bold idea that's taking shape in Montgomery County, Pennsylvania. It's called Thrive in Montco, PA. And get this, it's being pitched as a potential blueprint for the entire country. The whole idea is to figure out how to make our nation's founding promise real for everyone, right now, starting from the ground up. You know these words, right? They're basically the mission statement for the entire American experiment. But let's be honest, for almost 250 years, they felt more like an aspiration than a reality for a lot of people. Well, this initiative takes that promise from 1776 and uses it to ask a very urgent, very modern question. And here's what's so interesting about their answer. They're not looking to Washington for some top-down solution. Instead, they argue that the answer is right here in our own communities. It's a challenge to all of us, really. I mean, what better way to honor the country's birthday than by proving its highest ideals can actually work for everyone? So, how do you go about renewing a promise that big? Well, the core idea here is that real, lasting change doesn't start with a new law or a federal program. It starts locally, in places just like Montgomery County, Pennsylvania, with a totally fundamental shift in how we think about well-being. Here's the basic problem they've zeroed in on. So much of our society, our healthcare system, our community support, is almost completely reactive. We just wait around for something to break. We wait for someone to get sick, for a family to hit a crisis, and only then do we jump in and try to patch things up. It's a system designed to manage sickness, not to actually build health. And that leads us to the huge idea at the heart of this whole thing, making a complete 180. A total pivot from just fixing what's broken to creating the conditions where everyone can thrive right from the very start. And that is a profound shift in thinking. This slide just lays it out so perfectly. You've got the old reactive way of thinking that's always asking, why do people get sick? But the new proactive approach, what they call a salutogenic approach, it asks a totally different question. What actually creates health? What keeps people well in the first place? Okay, so let's break down that word, salutogenesis. It sounds complicated, but it's not. It literally means the origin of health. So instead of just focusing on what causes disease, it flips the script and looks at the resources and strengths that help people stay healthy and resilient, even when life gets stressful. Here's the best way to think about it. It's like tending a garden. You don't get a beautiful, flourishing garden by just running around trying to fix every single plant that starts to wilt. No, you do it by focusing on the fundamentals. You cultivate rich soil, you make sure there's enough sun and water, you create an environment where all the plants can just thrive naturally. That's salutogenesis in a nutshell. Okay, so that's a fantastic idea, but how do you actually do it? This isn't just some theory they're talking about. There's a concrete plan, a blueprint, with a very clear starting point for how to make it all happen. It all kicks off with this one number. 1,000. This is all about the first 1,000 days of life, from conception all the way to a child's second birthday. So why start there? Well, because study after study shows that this period is hands down the most critical window for human development. It shapes a person's health, their ability to learn, and their potential for their entire life. And to tackle this, the whole initiative is built on 4 key pillars. The important thing to remember is that they're all interconnected. Each one is designed to support the others, creating this complete ecosystem for well-being. You can see how these 4 pillars all fit together, right? It all starts with those first 1,000 days. But that needs to be supported by a community that has the right tools for families. And that requires totally transforming the healthcare system to be proactive. And then you tie it all together with technology that actually empowers people to take charge of their own health journey. All right, now let's dig into the tech side of things for a second, because this is where some really cutting-edge tools are being used to serve a very human, very community-focused goal. So this is the Whole Person Cellular Assistant, or WPSA. The easiest way to think about it is like an AI-powered partner for your family's health. It's not just looking at your medical records, it's designed to look at the whole picture, your lifestyle, social factors, you name it, to give you proactive support and connect you to the right resources right there in your community. And this table really shows you the massive shift this tool helps create. Just look at the role of patients. In the old, conventional system, we're kind of just passive recipients of care. But in this new salutogenic system, we become active participants in our own health. Technology like the WPSA is what actually makes that shift possible for everyone. But here's the thing, and it's so important. As powerful as this tech is, you have to remember that the AI and all the data platforms, they're just tools. The real engine of change here is people. It's about neighbors helping neighbors, sharing what they know, and working together to build a healthier community. That's where the real power is. And that brings us to the biggest vision of all, because this project was never designed to just be about one county in Pennsylvania. The entire effort is being built as a test case, a living laboratory, with the goal of creating a model for the whole country. Now, I know this map looks super complex, but honestly, that's kind of the point. You don't need to read every little box. Just step back and see how interconnected it all is. You've got government, healthcare, schools, local media. It's a true whole system approach where everything and everyone is part of the solution. And that right there is the ultimate goal. By documenting every single step, their wins, their challenges, what works, what doesn't, they're not just trying to help their own community. They're building a proven, replicable blueprint that any town or county in America can look at, adapt, and use to make that promise of life, liberty, and happiness a reality for their own people. So, of course, this leads to the final big question. This isn't just a story about what's happening somewhere else. It's a challenge for all of us. What would it look like if we started applying these ideas, this focus on creating health instead of just treating sickness, right where you live? What if your community was the next chapter in this story? And if that question gets you thinking, they make it really clear that there's a role for absolutely everyone. You can just be an observer and follow along. You can be a participant and actually join in. Or you could even be a founder and framer, helping to steer the whole thing. It's basically an open invitation to be part of building a future where everyone truly has the chance to thrive.